when I graduated from dental school, 1982, Columbia, obesity rates in the United States were about 8 to 10%. Now they're somewhere between 25 and 40%. And whether it's the chicken or the egg, you always, whenever you see that rise in obesity, a year to 2 years later, you always see the rates of apnea. So the apnea rates, I think, are approaching 20 to 25% in this country right now. It's out of control. And that's what made us start this group. And I'm glad that Xlear is going to be with us because we know how important it is that we breathe. And I want to thank Blaine for inviting me here. We met at the Greater New York Dental meeting, and Trish kind of got me into the whole thing of using Xlear and the importance of it. So I talked about the importance of nasal breathing. It really should be nasal and oral breathing. And you can see in the slide, I don't know if you can see that up above, but that's basically what we do, every day in the practice. We open up the airway. And I talk about Airway Centric because Airway Centric is a brand and it's just a way of thinking. It's a way of life. You've got a product called Xlear, okay? You need to have both of these holes open. You need to be able to breathe through your nose and you have to be able to breathe. I know you don't want to be a mouth breather, but the air has to be able to go past the soft palate and past the tongue. If either one of those are clogged, if you can't breathe through the nose, then I can't do my job with an oral appliance. It'd be like sucking through a wet straw. It's just going to shut. So you have to be able to breathe through your nose, and you have to have the passage open behind the... So what's the dilemma? I've seen this surge in obesity, learning disabilities. Everyone in New York has Asperger's, the spectrum disorders, ADHD, autism. There's this huge surge in obesity, allergies. When I was a kid like Chris Rock, back in Africa, there was no peanut allergies. Like when I was a kid, people didn't have allergies. Now it's prevalent. I do a lot of headaches, neck pain, and I couldn't help but getting involved in sleep apnea, cardiovascular disease, obesity. I can reverse endothelial dysfunction now. I can normalize it. And then at the other end of the spectrum, because I'm really into kids, but we talk about dementia and Alzheimer's, because it's just the other end of the spectrum. What are the answers? You're going to see in a second, we're becoming bulldogs. Mercury, and we've been big proponents for not using mercury, lead, heavy metal toxicity, low T3, toxins, the environment, obesogens, plastics, too many medications. I was talking to my friend Spear from Conscious Contact, mineral deficiencies, vitamin deficiencies, and we're all inflamed. We all have increased inflammation, stress, everyone's stressed out, and we have increased sympathetic tone. How about a new paradigm in dentistry? How about the paradigm of Airway Centric? How about dentistry for wellness? Dentistry to normalize endothelial dysfunction. Dentistry to alleviate fatigue. Fatigue's the number 2 or 3 complaint of all my patients. I don't do any tooth work right now. I know a lot about the teeth. I don't do any hands-on dentistry. I will do a very mild equilibration. How about dentistry to improve your memory? How about dentistry to alleviate ADHD, like Trish was saying? How about neurobehavioral issues? We have kids today that are disenfranchised, social withdrawal. They're aggressive. How about Columbine? How about these shootings? Who do you think is doing these shootings? These kids have airway issues. They have inflammation. And this is a problem that we have to address early. We have to prevent. Trish was right. We can prevent ADHD in many cases. I was a bedwetter. I got to admit it. My bedwetting went away when my tonsils and adenoids were taken out. My night terrors went away. It was a sleep problem. How about dentistry for headaches? How about dentistry to thrive, to do really well? So we've got basically 3 things that we do. We take care of performance, concussions. Of course, we do airway work, and then the Gelb 4-7. It's something where we were bringing the jaw down and forward to get rid of headaches, earaches, fullness of the ear, things like that. So my father, I got to give him credit because I wouldn't be here if it wasn't for him. And there's this Gelb 4-7 position. We bring the jaw down and forward. We talked about BioBlock yesterday, Bill Hang, Dr. Stagg. It's the way we think. Epigenetics has a lot to do with it. The question I was asked, epigenetics has a huge role because we've seen this phenotypic, the expression of our genes has changed so much in the last 30 years. It couldn't be just genetic. It's epigenetics. It's the role of the... If you don't know the word epigenetics, you have to know it. You have to know it. Our bodies have changed so much in the last 30 years because of environmental changes. The environment plays a huge role. And then I'm fortunate enough to be the head of... I ran TMJ and orofacial pain at NYU for 12 years, and now I'm teaching the sleep course there. We're also involved at Tufts in Columbia. This is what we used to look like. This is the primitive jaw. This is what I see every day coming into my office. And if that weren't bad enough, if we had a good jaw, we take out 4 bicuspids and we screw it up. The orthodontic community has been the worst thing in dentistry for the last 75. All we do is we close the airway. If you had an ability, you could do dentistry to open the airway or close it. Dentistry has been shutting the airway down for 75 years. This whole concept of centric relation, let's shove the jaw back, it's asinine. Michael Nuri's my patient. He's got a jaw like this, but he's one of the few guys that I know. We have narrow maxillas. 82% of our upper jaws are being pushed back. This is what I should see. This is what I see. Now, the lower jaw is better because the tongue is sitting down because we can't breathe. This is what we'd like to see, but even wider. This is what we see. This is what we see. And I'm becoming more, my Joy Moeller and Mark Moeller, my friends, my hygienist friends that are orofacial myologists, they're telling me about the importance of frenectomies early, like 2, 3, 4 days, 5 days. When you do the bris, do the frenectomy. Do it at the same time. Just snip it. And you know, you can't breathe through the nose. That's why you got to use clear nasal spray. You can't breathe through the nose because if you have a narrow palate, there's no nose. The nose should be this big with a wide palate. Our palates are narrow. The palate's taking up all the place. The high, narrow palate's taking up the place of the nose. We are mouth breathers. And whether you listen to Natalie Nevins, you listen to Cheryl, I've been fortunate to meet so many great people here. We've got to start addressing this. We've got to change the floor. We've got to change the pH. So the clear nasal products and the oral products work together to open the airway. I'm not a tooth guy. There's a huge application for these products to open the airway. We're becoming bulldogs. Now, bulldogs, that's the bulldog today. Bulldogs have no airway. The reason that I can get a lady like this to look like this within 3 months is because I'm increasing her oxygenation. I'm opening her airway. It's not about TMJ, it's about giving her a better night's sleep. Look at her posture changes. Forward head, better posture. I didn't tell her to stand like that. She's breathing. Look at her eyes. This woman was on the verge of dying. This woman is starting to thrive. And that's what she looks like today. She's one of my most beautiful patients that I have. She's a lovely lady from Virginia, and look at the difference. It's all because she can breathe. This is what's happened to our society today. This is Uga. This is the Bulldog, the Georgia Bulldog from 1956 to 66. This is the Bulldog today. The same thing's happening to the humans. We are Bulldogs. Don't let them have any xylitol gum, by the way. This is the modern Bulldog. This was the Bulldog the way it's supposed to look. We are Bulldogs. This is my patient. He's the Bulldog. He can't breathe. None of my patients can breathe through their nose, Blaine. No one in New York City can breathe through their nose. They all need the clear nasal products. Because I can't do what I have to do. And when I talk to Trish, when you talk about BioBlock, John Mew, Bill Hang, we can change the way your kids' faces grow. If you get kids to breathe through their nose and you do horizontal growth, this is the way you can change the faces of your kids. We're screwed as adults. We have to widen the palate. That's why we need these products. But if you change the way, if you get the kid to breathe and you do the right, 95% of all ortho is not good. It's very hard to find a good orthodontist in the United States. Is this going to be a future snorer? It doesn't have to be. We can prevent snoring and sleep apnea. We can prevent ADHD. We can change the behavior of the kids. Nighttime symptoms, daytime symptoms, mouth breathing, morning headache, habitual snoring. What we see at night reflects what happens during the day and reflects the breathing of the kid. But we can alleviate things like the ADHD, aggressive behavior, poor concentration, learning difficulties, memory impairment, poor academic performance. My friend Phil Cooper wrote a book, Why African American Kids Can't Read. We can get kids reading again. And it's all about getting them to breathe first. Breathing is the first, and then from breathing we get good sleep. You get good sleep, the brain functions. And by the way, if you don't get it by the time you're 8 or 9, it's really much harder. I want you to intervene early. You've got to get in there and do orthodontics when the kid is 3 or 4 years of age, because the brain's already developed by 8. Don't start the orthodontics at 8 or 9 when the brain's already developed. Get in there early, get the kid breathing from the time they're 6 months old. A lot of people think this is cute. It's not so cute. 27% of kids, the numbers are going up, but mouth breathing, like Tricia said, mouth breathing is not normal. Noisy breathing in your children is not normal. And this is what happens to your kid in school. The kid's going to fall asleep. This kid, you think this is cute. This is not cute. This is not a cute kid. Neurological effects may be irreversible. Neurological effects may be, Karen Bonnick, intervene early. Sleep, these problems, they occur, they peak between 2 and 8 years of age. Behavioral difficulties, we said it. You want to get rid of learning disabilities, you want to cut down learning disabilities, you want to cut down special ed, get the kid breathing early. There it is. Breastfeeding. You got to breastfeed. If you start to breastfeed, if you breastfeed at least 2 months, you will cut down sleep disordered breathing markedly. Breastfeeding, and immunologically, you'll shrink the tonsils and adenoids if you breastfeed. So we're getting involved with the doula. We're getting involved with midwives, because this starts when the woman, before the woman gets pregnant. That's when you have to start the counseling. And tonsils and adenoids, we've heard a lot about it. Even if you take the tonsils and adenoids out, if you don't change the flora, if you don't change them into nasal breathers, it doesn't work. You also have to do expansion. So I'm going to stop. It's not inevitable. We can change this if we intervene early, and I want to thank everyone. It's been a great few days here. Thank you very much.